Good evening, everyone. I'm Anthony Shembry, and I'd like to welcome you to tonight's St Vincent's Life Ball. I'm here in 9 South, our existing bone marrow transplant ward, and with your help tonight, we hope to raise enough money to reach our $5.2 million fundraising goal to build a new haematology and bone marrow transplant ward at St Vincents Hospital, Sydney.
St Vincent's was one of the first bone marrow transplant wards in Australia. We performed the first adult bone marrow transplant in 1975 in this hospital. And it's now really become clear over the years that for patients like this whose immune system is very suppressed and they're at risk of infection, the best outcome for them is to have their own bedrooms and their own bathrooms.
I was diagnosed when I was 17. It was actually halfway through my trial HSC exams. Turned out to be severe aplastic anemia. The plan was to just have a bone marrow transplant once I found a donor, because none of my 4 sisters or 2 parents matched, unfortunately. It was an 18-month process from there, just trying to get well again.
Tracy was my partner for many years. Tracy got something called graft versus host disease, which is when the new donor cells that are implanted in your body, they start producing blood cells, but those blood cells attack the body and see them as a foreign object. And unfortunately, yeah, he got a really severe case.
So with the new ward, we propose to have 16 single rooms, which will give the patients privacy and allow them to face their journey with their blood tumours or when they're having bone marrow transplants with their dignity intact, with their privacy intact. They can be with their family members. And secondly, the most important reason for the patients to have single rooms is to stop cross-infection and to stop the infections that we're worried about, which are very resistant to antibiotics.
The new ward will have private rooms, which is absolutely necessary, not just because I was at an awkward age between adulthood and being an adolescent, but because cross-infection is so common and it just makes you feel that much worse in the peak of treatment when you have a flu, because you don't know if it could turn into pneumonia, if you don't know if it could turn into just a simple chest infection, but it's a ripple effect on your whole family. You just want to avoid it as much as possible.
Going through the procedures and all the medications people have to take, it has some incredible and some incredibly nasty side effects, and you don't want to be on view to the world when you go through something like that. My goal is to have a room named after Trace Richie, so that means I have to raise $300,000.
With your support, we can continue to provide exceptional care at St Vincent's through our world-class facilities. Thank you.